the world are being celebrated for their hard work.
Yeah, that work is often challenging but rewarding. Our Stephanie Poole speaks with one area nurse who says the profession runs in his blood. Stephanie?
Whether you're in a big city or a small town, it all comes down to care. Meet Daniel King. He's a clinical LPN at Crossroads Family Medicine. That's a part of Tyler Holmes Memorial Hospital. He's been a nurse for nearly a decade.
It's hard work. Nursing's hard work. It's very busy.
Being a nurse in a small town has its shining moments. No one's a stranger, and King says it makes building relationships easier. Those relationships, he says, are crucial when it comes to care in a small town.
Health is just very important because we're localized. We can build those patient-physician, patient-nurse relationships without the patients having to go out of town to do it. To keep them here, to know they're going to be treated fairly and treated right is very important to the patients and very important to us here at the hospital.
Those relationships are often built outside the walls of the doctor's office, relationships that have a deep meaning.
It's really special to me. Like I said, especially when you see your patients outside of the clinic, whether, you know, grocery store, paying bills or whatever, when they come up and hug you because they trust you, you built that relationship with that patient, and it really makes you feel good.
But hospitals in rural towns face challenges. And Winona, one thing administrators say they're working to improve are the types of specialty care they offer.
Having to send the patients, you know, out of town for specialty, cardiology, you know, different departments. Although we're working on getting some of that specialized here at Tyler Holmes, we've got great leadership. We've got a great a physical therapy department, wound care center.
Being a nurse is something King always knew he wanted to do. It runs in the family. His mother works in the medical field, and so does his wife. For King, the job is more than just clocking in and out. It's a job he takes pride in.
It's a blessing when you have good health and to be able to help people that are not as fortunate. Just to hear the stories, you know, that my mom and my wife would come home, those feel-good stories, able to help, you know, a patient. And I just wanted to be a part of that. You know, I wanted to have that feeling of what's it like to give back.
Well, prior to working at the clinic, King worked as a home health nurse.